well, so was technical. So three more minutes, guys. We'll start the quiz. So those who are watching us on YouTube live, you can also join the quiz by using the link provided in the left-hand side of your screen, or directly you can scan the QR code as well. We'll wait for 2 more minutes. Two more minutes, guys. We'll wait for exactly 1 minute. Two more minutes, guys. Wait for exactly 1 minute. Okay, let's start. So welcome back, guys. Welcome to JuxtaMed Ortho quiz. So today the topics for the quiz are upper limb and spine as well as pelvis. So let's straight away go to the first question. Which condition leads to reversal of three-point relation or the triangle of the elbow joint? So think about the typical elbow alignment. In this injury, the bones are not where they are supposed to be, and it's causing a disruption in the triangle formation. So what could it be? All these type of questions can also be asked, and we often, if we miss the revision of these topics, then we'll see the answer. Yeah, the right answer is posterior dislocation of elbow because in case of supracondylar and olecranon process, olecranon fracture and lateral epicondyle, the 3 point is actually disturbed. But the question asked here is about the reversal of 3 point, which is seen in posterior dislocation of the elbow. Okay, let's see the leaderboard. Okay, we have Ashish leading, followed by Vishnu Priya, then Kalai Vannan in the third place, then Sriraj Maira. Okay, let's move on to the second one. A young woman presents with pain, swelling, and deformity of the following a fall on her outstretched hand. Radiographs show a fracture of the distal radius with dorsal displacement. Which of the following is most commonly associated with this condition? So you have to get a diagnosis and then later tell which nerve is most commonly injured here. Yeah, the right answer is median nerve compression. Yeah. Okay, we have Sriram leading now, followed by Vishnu Priya at the second place, then Ashish, Soumya, Kalaivanan. And we have Kavita, Myra, Ishwant, Javed, and Aisha. Okay, move on to the third question. A 16-year-old presents with chronic lower back pain, which causes activity and hyperextension of the spine. So on examination, there is tenderness over the lower lumbar region. X-ray of the lumbosacral spine reveals anterior displacement of the vertebra. What is the most likely diagnosis? Think seeing the image, you'll get the answer easily. X-ray of the See the alignment, guys. You'll get an idea. Think, yeah, it's spondylolisthesis. So yeah. Okay, we have Sriraj in the first place, followed by Vishnu Priya, Ashish, Soumya, then Yashwant, Myra, Kalaivanan, and X. Okay, guys, let's move on to the fourth one. A 45-year-old woman presents with a waddling gait. On examination, Trendelenburg test is positive. Which of the following condition is the most likely cause of this finding? So here, if you know mechanism of Trendelenburg test, you'll get the answer easily. So this test is actually done to assess the strength of the muscle responsible for stabilizing the pelvis during walking. So if it is positive, then it often points to the weakness in these muscles. Yeah, it's superior gluteal nerve injury. Also, can you guys tell which two muscles is more commonly involved here in this mechanism? Let's see the leaderboard now. Okay, not much changes. We have the same players, the same players. Then we'll move on to the next one. A 30-year-old male is brought to the emergency department after a high-speed motor vehicle accident. He is hemodynamically unstable with severe pelvic pain. So, examination reveals tenderness and instability of the pelvic girdle. What is the first step in the management of this patient? So, they are asking about the first step to manage. We know that pelvic fractures are an emergency case, and let's see. Oh, yeah, it's right. We need to use a pelvic binder in order to control the hemorrhage first. Yeah. Okay, not much changes now. We have Sriraj in the first place, second place Vishnu Priya, then followed by Ashish in the third place, then Soumya, Yashwant X, Myra, Shanmugapriyan, Kalaivanan, Reddy, Kavita, Ram, Krishna, Tanya. Okay, good going, guys. We'll move on to the sixth question. A 16-year-old boy presents to emergency department after a fall onto an outstretched hand. Examination reveals pain, swelling, and deformity of the forearm. X-ray shows a fracture of the proximal third of the ulna with dislocation of radial head. Which nerve is injured in this condition? And also, what is the diagnosis, guys? Can you please comment down what is the diagnosis? And the answer is a branch of which nerve? Yeah, it is. The right answer is posterior intraosseous nerve. Also, here the anterior intraosseous nerve is commonly injured in the supracondylar fracture of the humerus. So these 2 points we have to revise it often. We should not confuse this. I think they might test us on this as well. Okay, we have Sriraj followed by Vishnupriya, Ashish, then X, Ishwan, and Soumya. Good going, guys. Let's move on to the seventh one. A 48-year-old male presents with the low back pain radiating to lateral aspect of the left leg and into the dorsum of the foot. On examination, there is a weakness of the great toe and a reduced sensation over the first rib space. And all the reflexes are normal. Which of the nerve root is most likely affected here? I think the exact same question was given in AIMS. Uh, yeah, these type of question is often asked nowadays. Yeah, the right answer is L4, L5. To be more specific, I think this is L5 nerve root. Yeah. Okay, we have Vishnu Priya in the first place now, followed by Sriraj, Ashish, then X, Yashwant, and Tanya. Okay, guys, good going. So let's move on to the eighth one. A 7-year-old boy is brought to the emergency department after falling an outstretched hand. Examination reveals swelling and deformity of the elbow. Which of the following nerve is injured here? I think we already discussed it in the previous question. Let's see who gets it right. Yeah, it's anterior intraosseous nerve. Posterior intraosseous nerve is more injured in Monteggia fracture. Okay. Can you also tell where is the axillary nerve injured? In which joint dislocation and what is the sensory loss seen there? Okay, we have Sriraj back in the first place, then Vishnupriya, Ashish, X, Yashwant, Tanya, Myra, Ram, and Kalaivanan. And at the 10th place, we have Reddy. Okay, guys, last second question. A 23-year-old male presents with pain and tenderness in anatomical snuff box after a fall on an outstretched hand. X-ray shows no fracture, but pain persists. What is the most appropriate next step in the management? I think this question is asking you the investigation of choice, to be in simple words. Guys, can you tell me which bone is fractured here? Like, what is the name of the bone? And what is the complication of the fracture of this bone? Yeah, the right answer is MRI of the wrist. Okay, we have small changes here. The first place goes to Sriraj. Then second place we have Ashish. Third place we have Yashwant, followed by Vishnu Priya, X, Ram, Myra, Kalaivanan, Soumya Reddy, and Tanya. Also Hemant, the 11th place. Okay, guys, the final question, last question of the quiz. A 40-year-old man presents with sudden pain in the lower neck and upper back after lifting a heavy object. On examination, he has localized tenderness over the spinous process of the lower cervical and upper thoracic vertebra. So, what is your most likely diagnosis? I think this condition typically causes a localized fracture of the spinous process. I think the very easy clue is that it is involved in lower cervical and upper thoracic vertebra. Yeah, the right answer is clay shoulders fracture. Jefferson is C1 fracture, and Hangman's fracture is actually C2 vertebra slipping over the C3. It can be an example of spondylolisthesis. Okay, guys, let's see who nailed the quiz today. Okay, finally we have Ashish back. Ashish won the quiz today, so congratulations, Ashish. Then at the second place we have Shriyas. Then third place we have Vishnu Priya, followed by Yashwant. So congratulations, guys. So how was the question? Did you like the question or any suggestions from your side? You can comment us in this video. And that's a wrap for today's JuxtaMed Ortho quiz. So thank you all for participating. I hope you enjoyed the quiz. So until next time, keep learning and keep revising. Good night, guys.